Disorders of the gastrointestinal tract. Hemorrhoids. Hemorrhoids or piles are enlarged, displaced anal cushions derived from engorged veins, which primarily presents with anal bleeding. First degree hemorrhoids remain in the anal canal. Second degree hemorrhoids prolapse but reduce spontaneously, whereas third degree hemorrhoids prolapse and have to be replaced manually or remain prolapsed permanently until surgical treatment. The history is very important. The nature of the bleeding, associated pain, and other symptoms help to differentiate hemorrhoids from other more sinister conditions. Always do a digital rectal examination to exclude carcinoma and other conditions when a patient complains of pain or bleeding from the anus. Altered or dark blood or blood mixed with stools would raise suspicion of bleeding higher up in the rectum or colon. No treatment is required for hemorrhoids that are asymptomatic. Avoid the use of purgatives. The causes include increased intra-abdominal pressure, for example, chronic cough, pregnancy, intra-abdominal or pelvic tumors. Also, excessive straining at stools from constipation or diarrhea. Familial predisposition, chronic liver disease with portal hypertension, and anorectal tumors. Symptoms include passage of bright red blood at defecation. And it could be not mixed with stools, or may spray the toilet bowl, or only found on the toilet paper after cleaning. Symptoms may also include a mucoid discharge, swelling at anus, and perianal irritation or itch as pruritus ani, and discomfort after opening bowels. Anal pain occurs during an acute attack of prolapse with thrombosis, congestion, and edema. There could be symptoms of anemia too. Okay, the signs that are usually elicited are redundant folds of skin, that's skin tags, seen in the position of the hemorrhoids. Straining may show the hemorrhoids, but there may be none. Inspection of the anus and digital rectal examination may be normal. There could be swelling at the anus in third degree hemorrhoids, and palpable thrombosed internal hemorrhoids on rectal examination. Signs of complications like profuse bleeding with anemia or hemorrhagic shock, prolapse, strangulation, thrombosis, infection or ulceration could be present, and there could be pallor too. Investigations include FBC, full blood count, and proctoscopy. That's a gold standard for diagnosis. Sigmoidoscopy to exclude carcinoma of the rectum. For treatment, the treatment objectives are to correct anemia if present, to relieve symptoms, and thirdly to prevent complications. Non-pharmacological treatments include increased intake of fluid and roughage. Avoid prolonged straining at defecation. For prolapsed hemorrhoids, lie patient down and elevate the foot end of the bed. Try gentle digital reduction after application of local anesthetic cream. If this fails, apply cold compresses. Sedation of the patient may be required. For infected hemorrhoids, warm sitz baths 2 to 3 times a day. Surgical treatment, rubber band ligation for second degree hemorrhoids, Hemorrhoidectomy for third degree hemorrhoids. Hemorrhoids developing during pregnancy should be managed conservatively, as most will resolve after delivery. For pharmacological treatment, when associated with constipation, you give liquid paraffin oral, as in adults 10 to 30 milliliters at night, or Sina granules oral for adults, one sachet with water after supper. When associated with local itching or discomfort, give a soothing agent with or without steroids, applied or inserted rectally. For adults, one suppository 12 hourly for 7 to 10 days. For infected hemorrhoids, first line treatment, you give gentamicin in adults, 40 to 80 milligrams 8 hourly for 5 to 7 days. And you could give metronidazole oral in adults, 400 milligrams 8 hourly for 5 to 7 days. Second line treatment, that's for infected hemorrhoids, you give ciprofloxacin oral 500 milligrams 12 hourly, and metronidazole oral in adults, 400 milligrams 8 hourly for 5 to 7 days. And third line treatment, you give amoxicillin oral in adults, 500 milligrams 8 hourly, and metronidazole oral in adults, 400 milligrams 8 hourly for 5 to 7 days. When associated with anemia, you give iron preparations like ferrous sulfate or fumarate, and blood transfusion could also be given. The referral criteria: the patient should be referred to a facility with resources for rubber band ligation or operative treatment if indicated.